I feel very fortunate that every night I crawl into a bed, not only with a man that I still love, but I still like him. And I think that's huge.
There was something special about her. She had great values, and really I was amazed by her, and I thought, this is the kind of person that I want to share my life with.
I'd let it sink to the bottom, 'cause I only care about one thing.
We have 3 wonderful children and been such a huge blessing in our life. We were looking forward to what life would hold for him and I.
None of it matters as much as you matter to me.
Tony was an avid cyclist.
2016, I cycled over 10,000 kilometers. So I was very in tune with my body, very healthy diet.
He joined a cycling club, and then that was it. He found a second family.
Angela and I went for a walk, and my gant was slightly off.
And I could hear. And I said, "What is that?" And he says, "My legs are tired." So I said, "Okay, when we get back, we really need to call the doctor." So he did. She saw him the next day. She watched him walk, and she says, "No." She says, there's something.
That is really like a kick in the stomach. You're shocked, you cry, all of those things, but then you have to carry on.
We told Anthony first, because his reading week was first.
When they told me, I just couldn't stop crying.
And then Emily came home the second week.
Sobbed and sobbed and sobbed. That goes without being said. You know, it sucked and it wasn't fair.
Our older one lived here, so she has seen it all with us. We had the option of Sunnybrook or McMaster.
We chose to go to Mac, and from day one, they were very kind, very compassionate.
Dr. Turnbull has such an awesome reputation. So Tony said, "Okay, Mac's our place." So off we go. We meet Dr. Turnbull. He did some initial testing.
ALS is a disease that attacks your motor nerves, and as a result, it affects your ability to move. Everyone knows someone with ALS, whether it's a loved one, or a neighbor, or a coworker. 90% of ALS remains sporadic, meaning we don't have an identified cause. 10% of ALS is genetic or familial.
It's little wonder that we couldn't solve this disease, understand this disease 15 or 20 years ago. We didn't have the tools. But now we've actually got the tools. We've got genetic tools now that are just absolutely remarkable.
And there's now studies looking at genetic targeted treatment for some of these forms of ALS. So that's very exciting.
When I started the ALS clinic, I was the ALS clinic. And with time, the clinic built up to the point, I think we probably maybe the biggest or second biggest clinic in the country right now.
And there's an explosion of therapeutic clinical trials. Targeted therapy was not something that was even on the radar 5-10 years ago.
We now have the potential to actually fix the problem. We've got a few technical hurdles to overcome, but this is definitely a possibility.
And hopefully in that development will give us clues as to how to approach treatment for sporadic ALS and cure as well.
The internet has just been remarkable.
It's very easy for different labs to share data across the world. And as a result, for one thing, different labs across the world, rather than working in different individual silos, the research effort is much more unified.
What is better is our supportive care. The team is a good team, it's a cohesive team.
4 years ago, there was only one therapeutic trial that we were running. Now, in these past 2 years alone, there's at least 5. So there's been tremendous interest that's been generated as a result, some of which actually have been shown promising results and are going on to further study. I'm hopeful that in the next few years, we're gonna have additional therapies approved and we're gonna be able to improve patients' life with ALS.
We do make an impact on people where I think we improve the quality of people's lives.
When you go into his office, he treats you like you are the only person with ALS.
You felt good about, and unfortunately, a very ugly disease. They give you back some of your dignity that unfortunately this illness strips away from you.
The commitment and dedication that he has to this disease is incredible.
Is there glimmers of hope? Absolutely, there are.
I think there is quite a bit of hope. Right now, we're in a renaissance period in terms of ALS research.
Some of them in the specific areas of the familial disease have a potential to make a major impact. The Hamilton Health Sciences has been very generous in supporting the clinic.
And the public's support behind ALS, both patient care and research, has been tremendous.
The problem, as you can see, is that this takes money to run an enterprise like this. And so we need the financial support to invest in the research aspects, some of the equipment, and we need some financial support to deal with the patient services that the hospital doesn't provide. We use the support from the gala to provide better care for the patients.
I think what's important moving forward is to continue that momentum, continue that energy and passion, right? Because at the end of the day, that's what these patients need, right? Advocacy, not just from their care, not from the challenges they face, but also for cure as well.
Support is so important. You know what, if you're gonna have a limited lifespan, to be able to live with a dignity and pride and to be able to enjoy those last few days, not just for yourself, but others around you, is so important.
We enjoy being here. We enjoy spending time with them, and given the circumstances, it's nice to be able to spend that time together.
And to have the outlook he does is incredible. We're truly blessed to have each other.
We're hoping that this tide of advances that is taking place with ALS, all disease but ALS, we're hoping that that's going to translate into something tangible for the patients in the not too distant future. And I'm optimistic that it will.